the biggest problem we face in infertility is the aging of the eggs. So if they're 25 years old and they've been trying for a year, well, the general thinking is that give them at least a year to try to get pregnant on their own, give them counseling, for a type of counseling for intercourse. The most important thing you can do is realize that you can't time the ovulation accurately because the egg is no good after 8 hours after ovulation. So the important thing is to always have sperm there. So I recommend, and the husbands love this, but I recommend that you have a lot of sex, at least 3 times a week or every night, because what you want is not to try to save up sperm, but to always have sperm there whenever the wife ovulates. And after intercourse, the sperm is usually good for 2 to 3 days in the wife's fallopian tube, and so at least 3 times a week is important. And don't try to pay attention to when you ovulate because you'll never really get it right. You just want sperm to be there always. Anyway, that type of counseling is absolutely adequate and all they need if they're young. On the other hand, if a couple is in their 30s, like 35, then it's really important to go to IVF right away and not to try all kinds of secondary treatments that aren't very good and aren't very reliable. By age 35, you're almost in crisis mode because the eggs are rapidly declining. You can see on my website the rapid declining after age 35. It's like falling off a cliff. So if it's a 35-year-old couple or older, then they shouldn't wait to get treatment. They absolutely should not wait. And